What do you love about being a clinical psychologist?
So, what I love about being a clinical psychologist is really that I get to do a lot of different things in my job. And I don't know if this so much speaks to being a clinical psychologist or just where I work. I work at UK's Counseling Center.
Right.
And so, I work with university students, but I get to do just so much. I think a lot of times when people think of clinical psychology, they think about psychotherapy.
Mhm.
And that's a big portion of my job. And it's, of course, a portion that I really love, or else I probably wouldn't have become a clinical psychologist. So I get to do psychotherapy, but I get to do a bunch of different types. For example, individual therapy, group therapy, crisis counseling services. And I get to do it with a bunch of different students, the 18-year-old first year student to, a 30-year-old graduate student,
Mhm.
like a huge range actually. So I get to do that. I get to do outreach, presentations and programs. I get to be involved with our training program, so supervising other students who are in doctoral programs to become psychologists themselves. Right now, I'm also doing coordinating our mental health peer advocate program. So I get to work with mostly undergrads. We do have a couple of grad students who have been involved in the program. So yeah, I get to really do like a lot of different things, and that's what I really mostly love about being a clinical psychologist.
Yeah, well, that's awesome. So what does the average workday or week look like for you? I know you have a lot going on. So what is like a kind of like a set thing for you?
Yeah, yeah. Well, part of why I love like the answer to this is like it looks every single day looks different. I don't have basically the same day as the next one, which I really like.
Mhm.
It keeps me like really engaged. And of course, I'm busy, but it's not like so monotonous that it's the same thing after another. So, for example, on like Mondays are sort of my less busy days, and then it progressively gets busier every day of the week. For some reason, I don't know why it ended with Friday being my busiest day, but I might.
It gives you something to look forward to
Yeah, I guess
with the
so.
weekend.
Yeah, for example, I might see a couple of individual clients, might have a group. I might have like a meeting here or there. I might do an outreach program. So it really varies on the day. And really, no 2 day is set up the same way.
That's pretty cool. Well, I'd love to
Yeah.
hear that.
Yeah.
Um, so what is something that you wish you knew before becoming a clinical psychologist?
So I've been thinking about this question, and two things really come to mind. The first, and I know you'll ask me, we'll talk about the differences between counseling and clinical psychology, differences and similarities.
Mhm.
I think I wish I would have just known about the different areas, and specifically, I wish I would have known more about counseling psychology. For reference, I'm a first generation college student, so I navigated applying to grad school like, on my own. Of
Well,
course, I
yeah,
had the help of
yeah.
yeah, and I had the help of mentors, which was great, but I was kind of like, there's a lot I didn't know.
Right.
And so I think what I wish I would have known is just like, first and foremost, what are the options?
Yeah.
I knew I wanted to be a psychologist. I knew I wanted to get a doctorate, but I wish I just would have known a little bit more. With that being said, I probably still would have chosen clinical psychology,
Yeah.
but I think I just wish I would have had more of that knowledge of what else is out there.
Yeah. Right. So to finish it off, you were correct. We were going to talk about the similarities and
Mhm.
differences. So how do you see your identity as a clinical psychologist influencing how you're trained and approaching your job duties?
Yeah, this is a really good question. And I had to think about this one even longer than the question
Yeah.
before, because to be honest with you, Madison, I think of my identity as a psychologist, at the clinical part is really not super salient to me. And
Mhm.
I think that that is just because of like the environment where I work. I think
Yeah.
it would feel more salient if I were somewhere else, maybe in a medical clinic or, and the reason I say that is because there's a lot of us, a lot of us who are psychologists at the counseling center, and the majority, I'd say, I didn't count this up, but I'm pretty confident the majority are counseling psychologists.
Yeah.
But under the law, our license, we're all licensed psychologists.
Mhm.
So to me, in the role that I'm in, the clinical part is not super salient. So whatever your career goals may be, I hope that that feels sort of like um, a little bit less anxiety producing about which route to take, because
Mhm.
I think that there's so many opportunities. And especially now, I mean, if you've read about the history between clinical and counseling psych, it used to be quite different. And, more and more, I think there's overlap.
Yes.
So yeah, hopefully with that being said, it takes away some of the anxiety of like, hopefully whichever one you'll choose, you'll get to do the job that you want to do. Um, so that to me feels, yeah, it just doesn't feel super salient. I suspect though that some of my like classmates who I went to grad school with, some of them are working, for example, they're not doing much psychotherapy, they're doing a lot of assessments.
Mhm.
Um, so maybe then that feels more salient to them because being trained in assessment is a pretty big part of clinical psychology.
Yeah.
Um, so it's not something I do a whole lot of now in my job. So maybe that's part of why it just doesn't feel super salient. But I don't know. It is. I'm happy with the route I took. I'd take it again.
Yeah.
I'd take it again if I had the option. And I think that it's pretty like wide ranging in where I could work.
Yeah. That's really cool. Well, I know this isn't on the list of questions, but I was curious as to why you chose to work more in the university setting rather than like a clinical setting.
Yes, I love this question because actually, this is another, I forgot to add this. This is another thing I wish I would have known. I wish I would have known how many places you could work and what those
Right.
were. Because when I was in my training, so I went to Marshall University and got my PsyD, clinical psychology, PsyD there. And the focus of our training was on serving rural populations and other underserved populations. And so our practicum sites were set up at um, a lot of medical clinics or integrated primary care centers. So some of my practicum experiences, like we all were in the psychology clinic, and that's, you might be familiar with the Jesse Harris Center here at
Mhm.
UK. It's pretty similar then. But then I also got to train in a psychiatric hospital.
Oh, that's cool.
And yeah, it was so cool. And I also got to train in a rural integrated primary care center. So it had, the dentist, your primary care physician, behavioral health, which is what I did, all in one building. So
Okay.
I really thought that's the direction I was going to take.
Yeah.
And to be honest with you, Madison, we did not even have counseling center training as an option. So I go through, yeah, it just wasn't an option. So I go through my program and I'm like really thinking I'm going to go into primary care, integrated
Mhm.
primary care. And I did like it. I did. But it was a lot of like the same thing over and over and over. And it was much briefer sessions.
Okay.
So they were scheduled for like 20 to 30 minutes,
Oh,
as opposed to like a 15-minute clinical session.
right.
So you had to do stuff really quickly. I might see like 12 patients in a day, which is really
That's
exhausting.
overload. Yeah.
It's super exhausting to me. Um, and I'm more of an extroverted person too. So I love working with people and interacting and I get energy, but off of interacting with people, but that amount, and it's therapy too, right? So it's not just like, it's deep stuff we're talking about here.
Right, right. It's not
Um,
like something like this.
yeah, yeah, yeah. So I realized this is really not what I want to do. And so when I was applying for internship, I was reading through all the descriptions and I noticed I kept being drawn to university counseling centers,
Mhm.
like just over and over again. And what I realized is one, the variety of things you get to do that appealed to me. And I noticed a lot of emphasis on social justice as part of like core values of a lot of
Okay.
counseling centers. And that was a very common trend that I noticed that I was really drawn to because I wanted more of that. I wanted a workplace where we talk about diversity and inclusion and how that looks and how it's not happening, and I wanted that. And I
Right.
just So I thankfully got an internship at a counseling center, and I don't think I'll ever go back.
Gotcha. That's really cool.
Yeah.
Um, I also had another question. I know it's not like also on the list, but I am looking at getting my PsyD as well.
Oh, cool.
So how kind of like was that process for you, and why did you choose that versus a PhD?
Yes. So in my particular, I know not all PsyD programs are like this, but our model of training was practitioner scholar. And
Mhm.
so basically what drew me to a PsyD versus a PhD is I knew I wanted to be a clinician. Like I wanted, and of course, people with PhDs are clinicians as well, but
Yeah.
I knew I did not want to have a heavy emphasis or focus on research. I knew like, okay, I'm going into this for the clinical aspect.
Mhm.
That's what I really, really want to do. So that's how I made that decision. Um, I knew, at the time when I was applying, I really wanted to focus somehow on like rural or underserved. Now I'm working in Lexington, Kentucky, so not not as rural as what I was trained as in West Virginia, but that's really what drew me to the PsyD program that I eventually went to.
Okay. Yeah.
Like I still did research.
Right.
I still did a dissertation. It wasn't, as horrible for me as like some of my other colleagues I knew who've gotten PhDs. Like, we actually referred to it as a doctoral research project
Mhm.
instead of like a full length dissertation. So it was way more manageable to me than like a full length dissertation would have been. So
Mhm.
I enjoyed that I still got to do research. I still got, I had classes on, research methods and that sort of thing. So I'm still knowledgeable about that, and had that experience, but I knew that's not what I wanted to do full
Yeah.
time. And I will say too, I think, I know a lot of my faculty were PsyDs. And so a lot of people I know who have PsyDs, sometimes, not a lot, but some of them I know do end up doing mostly research or work in academia, or like are a little bit less focused in clinical. But traditionally, I think that it's more of a clinical focused
Okay.
degree.
Awesome. Well, thank you so much.
Yeah,
Do you
sure.
have any other comments or anything for me?
No, I don't think so.